today. I think the first thing I'd like to ask you is what sets your practice apart? What makes it different and unique from some of the other practices in town?
I'm more focused on people understanding why their children have dental problems. Of course, I want to fix them, but I really want people to understand why their kids have the problems, the ultimate source of them.
How do you go about that?
Well, I generally ask a lot of questions when they first come in. Was your child a full-term baby? Was your child breastfed, bottle fed? For how long? What's their diet like now? Are they healthy eaters? Do they sleep well? Those are not typical questions that a dentist asks, but it's moving in that direction.
And when you ask those kind of questions, I'm guessing people are surprised.
Yeah, like, boy, I just came to get my teeth cleaned. Why are you asking me all this stuff? And then that usually starts a conversation, and it makes sense to a lot of people. It's like, oh gosh, you're right, that makes sense.
So how does your approach then to treatment of these various issues the kids might have, how does it vary from other practices?
Well, when I first started practicing dentistry, and I come from a long line of dentists in my family, it's cavities, cavities, cavities. I call that putting out sugar fires. And I just sort of like, I'm real tough on sugar, and I'm tough on eating unhealthy food. I want people to eat healthy. So right away, I've identified what's causing all the dental problems. It's mainly dietary. They don't teach a lot of this in dental school. I have a nutrition background. I'm also developing a background in anthropology. So that's not real common in the dental field. Nutrition isn't taught in dental schools yet, not so much. So I think that's really, instead of putting out sugar fires all day, which most dentists are doing, I like to educate my patients mostly, other than treating it. So.
And how do you find that they're responding to that?
Well, we don't treat a lot of tooth decay in this practice because there isn't a lot of tooth decay in my practice. I'd like to think that our approach is maybe accounts for some of that, but we're fortunate. We're in an area where kids have access to a lot of things that some kids don't in other areas of the city, and I'm hoping that we can help set an example and have this spread all over the city.
One of the areas that you have started focusing on is sleep apnea. Explain to me the connection between sleep apnea and dentistry.
Well, sleep apnea, again, is if a child snores. Doesn't mean they have apnea, but most people who have apnea do snore, even though the converse isn't true. But the shape of the mouth has a lot to do with the ability to breathe normally through your nose while you sleep. Most adults who have apnea, it started out in childhood, and we're finding that the shape of the jaw, like a narrow upper jaw palate, crooked teeth, that's not a disease. That's a symptom of a child whose tongue is not up in the roof of their mouth and off the back of their throat. It's quite simple. So
how do you treat that when you find a younger child that has some of those issues?
Well, how young? I mean, I get called into the neonatal intensive care unit at Children's Memorial sometimes because kids are born with disorders that just predispose them. That's kind of rare. But, those kids sometimes need surgery. Well, other kids who don't have medical problems, we can pick up the signs at 1 year old. If a 1-year-old is snoring, that could be indicative that their brain is being starved of oxygen while they sleep and can lead to behavioral problems down the road. Even IQ, it can affect IQ. We start practicing telling the parents to feed their children firm food and stay away from junk food. That's one thing. And the other thing is the way that the shape of their palate. The tongue can actually shape the palate really early in life, like 1 or 2 years old. And we use these things called tongue trainers that help train the tongue, which is a muscle, to develop the palate right, which can lead to healthier breathing at night.
What kind of things should parents be looking for? And what are some of the signs that they might see or hear or notice in their child that would indicate to them that this might be something that they should be talking to you about?
Well, if the child is not, if they're potty trained, but they wet their bed, if they grind their teeth at night, if they snore, if they walk around with their mouths open, if they have dark circles under their eyes, those are all real strong indicators. If they're not paying attention, if teachers report, and they don't even have to be diagnosed with ADD, I mean, there's a consensus now in the scientific community that ADD does not exist. It is a symptom of poor sleep. So I would, those are some real powerful risk indicators that we call it a sleep assessment we do. And if enough risk indicators are there, I refer them for a sleep study at
And
the
that's
hospital.
something they do elsewhere.
Yeah,
right?
at Children's.
Mm-hmm. And so what's, if that sleep study comes back and it says, yes, your child has sleep apnea, then what do you do to help?
Well, I usually discuss it with the sleep physicians. We have two at Children's, Dr. Sheldon and Dr. Lagmani, and discuss, is this, because some sleep apnea is what we call central apnea, and it could be related to other things other than the shape of the mouth. But what they want me to do, and I get referrals a lot from sleep medicine, is to rule out that there might be something going on in the shape of the mouth that could help this child breathe better at night. And depending on, usually 3 or 4 years old, I will start expanding their palates, not for orthodontic purposes so much, even though I use orthodontic appliances, to make room for the tongue. And then there's a series of things that we do, and most kids start to improve that are referred to me.
How common a problem is this?
It's very common. It's 2 to 10% of children in the United States have some form of what we call sleep disordered breathing. It's probably higher than that, but in terms of it being diagnosed, it's only recently been understood that there's things that dentists can do. At very young ages, if you catch it real early, you can prevent major problems down the road.
I would think that many people would be surprised that sleeping and dentistry had any connection.
Well, for adults, it's becoming a huge thing. There's a lot of people adults that have to have CPAP machines. They're machines that force air into your lungs while you sleep. They're cumbersome. People hate them. Well, we found out that if you move your jaw forward while you sleep, you make more room in the back of your throat and you breathe better, and you don't need the CPAP anymore. Well, then they said, when did this problem start? And we were finding out that it starts as early as infancy.
Dr. Boyd, you are studying anthropology, which is an interesting road to take, I think, for a pediatric dentist. What is the connection between anthropology and your practice?
Well, again, my interest with my patients is that the parents understand, do you know why your children have dental problems? The sugar one is pretty easy to figure out. There's a connection there, and most people know it. But crooked teeth, like, what do you mean? Like, it's genetic, right? And it's like, well, no, it's not. It's something called epigenetic, which led me to explore anthropology when I heard an anthropologist say, do you know that there was no need for an orthodontist till about 300 or 400 years ago? Nobody had crooked teeth or impacted wisdom teeth. Maybe a few crooked bottom teeth, like in Egyptian mummies 10,000 years ago, or 4,000 years ago. But for the most part, most humans had all 32 of their teeth in, wisdom teeth, everything, until about the Industrial Revolution. And things started to change, and that fascinated me.
So what have you learned in your study of anthropology that impacts how you treat your patients today?
Well, it's just like we pretty much know that two eyeballs are meant to fit into 2 eye sockets in your head. Everyone's got them. This may be kind of a leap, but you know what? Pretty much everybody has room for 32 teeth. Potentially, genetically, it's all there. It depends on the environment of the mouth and the challenges to it early in life that sort of dictate, is a jaw going to be wide enough to accommodate all 32 teeth? Well, what we know is if a palate, an upper jaw, can accommodate the tongue, it will accommodate 32 teeth. Go figure.
Kevin, you are pursuing a degree in anthropology at this stage in your career, which is a very impressive thing to do. But how does it connect to your day job of being a pediatric dentist?
Well, for me, it helps me in my day-to-day practice of dentistry. Just as I'm concerned that parents really understand the ultimate cause of their child's dental disease, when I heard that there was no cavities in humans till 10,000 years ago, and we've been around as humans for 200,000 years, most people don't know that. They didn't teach me that in dental school. They don't teach it in medical school. I began to pursue an interest in what's called evolutionary medicine or Darwinian medicine. I'm more concerned with how did crooked teeth happen? How long has that been around? And I found out nobody had crowded, crooked teeth. Nobody had impacted wisdom teeth till about the Industrial Revolution in the mid 18th century. That's when it all started. And I'm like, this is fascinating. So I'm pursuing research in this area. And it impacts how I know when I see a child with crooked teeth. If I get them early enough, I can make their jaws accommodate not only all their teeth, but their tongue. That's what's missing. That's why pre-industrial people never had crooked teeth. Their tongues were always up and forward in the roof of their mouth, and they had good posture.
So, Kevin, when in your practice today with this new study of anthropology that's part of your ongoing education, how has that impacted how you view your patients and how you treat your patients? What's changed now that you have a greater understanding of Darwinian dentistry?
I have such confidence when I see a young child that has crooked teeth. I used to just say, you know what, crowded baby teeth always mean crowded permanent teeth, and just get ready for orthodontics. Well, now I know that people, older kids, adults, anyone who has a problem, just like with apnea, if they have crooked teeth in childhood, it's setting the stage. If you fix it in early childhood, you help mitigate and prevent all kinds of problems down the road, not just with cosmetics, the way it looks, but with the ability to breathe through the nose. So I can have great confidence in telling a mother of a 2-year-old who's got crowded teeth and a deep palate, if you let me start working with your child, I can really help your child have less chance of having severe crooked, crowded teeth when they're older. It won't prevent it, but I can make it less, and most of all, I can help the child breathe better through their nose if I can intercept this early in their lives, under 5.
Treating children under 5 and even between 5 and 10 is different than how it used to be for orthodontia especially, right? I mean, it's I think a lot of parents would be surprised that they could come to your office with a toddler and you might say, we need to start working on some things.
Mm-hmm.
There's, I think, been a feeling that you start fixing crooked teeth when they're teenagers or in middle school or something, but you're starting to work on children much younger.
Well, it has to do with the concept that crooked teeth is really not a disease, it's a symptom. And we want to treat the ultimate cause, and that is tongue posture. The palate has to be wide enough and forward enough, the upper jaw, so that the tongue can be up and forward and off the back of the throat. Traditional conventional orthodontics, which is kind of what I was brought up in, was focused more on straight adult teeth. And why not just wait till they're older? If straight teeth is your only concern, then yeah, it makes sense to wait. And most orthodontists are starting to change their thinking on that. I think the American Orthodontic Association says that children should be seen by 7 or 8 years old. Well, 7 or 8 is when the upper jaw is its full adult size. So for me, that's way too late. Children should be evaluated for the shape of their jaw somewhere between 1 and 2 years old. Not necessarily getting treatment then, but evaluated. So it's just changed. Crooked teeth and misaligned jaws it's not a disease, it's a symptom.
You have, beyond yourself, you offer other services and other expertise around this area. Can you tell us a little bit about that?
Well, one thing is I'm on the sleep medicine team at Children's, and I do a lot with issues related to sleep, mainly with the shape of jaws, but also kids that have other disabilities. My profession, pediatric dentistry, is very esteemed for this. We feel that all kids with special needs, and even young adults with special needs, should have access to everything that any kid could get. And that includes orthodontics. I have a fair amount of kids with autism, with cerebral palsy, that I do full orthodontics on them. It takes forever, but the results are very satisfying for me and for the families.
And you also have an oral myologist on as part of your team? Explain that to us and what that means to your patients.
An oral myologist is a new branch, very popular in Brazil. It's catching on in Europe, and it's starting to sweep the United States. The only people that can become qualified in this specialty are speech pathologists, dental hygienists, physicians, and dentists. There are very few physicians and dentists that actually will go through this intensive training, but I actually employ 2 oromyologists on my staff because it helps my orthodontic results get treated faster, and there's less likelihood of relapse, and it encourages upward and forward positioning of the tongue, which is conducive to nose breathing while you sleep, which it has all kinds of health benefits. So it's a new and upcoming specialty, and I think it's only a matter of time before every dental office in the country is going to be associated with an oromyologist.